Okay, so let's talk about this from a clinical lens. So this is like the geek and nerd in me absolutely loves this conversation. And I would like to also extract it to have some clinical application for our listeners. So a lot of the people that listen to the show typically are perimenopausal, menopausal, the things that were working for them in their 20s no longer working for them in their 40s or 50s.
Mhm.
There's an accumulation of ectopic, they have like ectopic fat distribution where they're starting to see more of that fat sort of centrally versus if you're a woman, you typically under the influence of estrogen tend to deposit fat, let's say in the hips and the butt, lower stomach, that kind of thing. And then we see this sort of wildly vacillating levels of estrogen through our 40s and then the eventual sort of fall off a cliff, through menopause, and progesterone is included and testosterone is included in there as well. So maybe we'll just start with hormones. I do want to talk about a couple of other, you mentioned autoimmunity. Certainly women deal with things like Hashimoto's thyroiditis at levels, orders of magnitude much larger than our male counterparts do. And then osteoarthritis, frozen shoulder, very common in females, 40s and 50s. And I certainly clinically have seen that almost ad nauseum, really. So let's talk a little bit about hormones and how, we know that prior to menopause, it is the ovary, in females anyway, it's the ovary that's primarily making our sex hormones. How can we potentially utilize some of these stem cell therapies and gene editing technologies that you're developing to support, augment ovarian function?
Yeah, the person I learned from on this is Victoria Felker. She's a fantastic scientist on fertility, and she has done a lot of work into the root causes of infertility and also of hormonal issues and women aging specifically. And so not shockingly, it's actually the same root cause. So the ovaries are just like any other cell in your body. They get mitochondrial dysfunction, they get the chronic inflammation, they get all the same hallmarks of aging, and the ovaries age too. So the question is basically, how can we de-age the ovaries?
The
And we can
oocyte, maybe.
and
Yeah.
we can
Yeah.
do that pretty reliably when we do what are called intra-arterial ovarian injections with stem cells and exosomes, because they're targeting those hallmarks of aging, like we talked about earlier. And then we also can do systemic treatments to de-age the whole body. And so that's our follostatin gene therapy, for example. That's a plasmid gene therapy. It's essentially, when people think of gene therapy, they get kind of scared. They're like, "Are you modifying my genetics? Are you changing my
Is
genome?"
this a COVID vaccine? What is
Yeah,
this? Yeah. Yeah.
yes, COVID
Right.
vaccine. No,
Yeah.
it's much safer than that, actually.
Yeah. Yeah.
So,
Yeah.
so the beauty of this plasmid vector is it's just a delivery mechanism for your cells to make more follistatin. And so follistatin is actually highest when you're pregnant. And so why is it high when you're pregnant? Because it's actually an anti-inflammatory kind of protective peptide. It's naturally occurring in your body, but as you get older, the levels decrease. And so we're kind of just restoring them to an optimal level through this injection, but it also de-ages your entire body anywhere from 5 to, some people were like 20 years, based off intrinsic biological age and epigenetic reduction.
What are you
So
measuring there? Sorry to interrupt you, but what are you measuring there
it's
to
true age
quantify the five?
diagnostic. We use their technology for that clinical trial that we did,
Oh,
which is a true age diagnostic, is essentially looking at inflammation is probably the biggest one to look at a DNA methylation of CRP.
mhm, mhm.
And then, so that's the one that we use for the trial. However, on your point about entropy, you're probably on the right track, because I think the best aging test now, from what I'm reading, is called Generation Lab, and they use biological noise, which basically measures like entropy in the body and
Oh, I like that
different organ systems. So I think
noise.
that's the one we're going to use for our second clinical trial, which is starting later this year. But back to the point. Basically, when you de-age your body, and restore your ovaries to a younger age, essentially, then you're going to get better hormonal production. It's because it's the same underlying processes that are causing the ovaries to age and to not be able to do what they used to do.
And does that extend your fertile years then? Would that extend
Yes,
your
we've had
period?
patients.
Yeah.
Obviously, we need to do more trials, but I can tell you anecdotally that we've had patients who were unsuccessful with IVF, with trying everything, and then we did the stem cells, and then they were able to get pregnant. And that's just because, what's the mechanism there? It's the same. It's the same thing. It's basically targeting those hallmarks and getting the ovaries to start working again and regulating their cycles and producing the estrogen and everything.
That's an interesting, yeah, it's an interesting thought experiment in a way, because I had, on the one hand, certainly for if you were, let's say 30 or 35, 40, 45, and you've been, focusing on your career, and then you're
Yeah,
like, oops, it's 40, I'm 44.
exactly.
I
Yeah,
would like children. I think that this is a godsend in many ways. And then for a woman, let's say, who is in her 50s or 60s, who, where her ovaries have, we've had this entropy or we've had this decline, and now the adrenals have sort of taken over that sex hormone production, or just, the ovaries quit and then the adrenals just sort of keep puttering on. Is there any case studies, or where we're seeing like 50 and 60-year-old women regain their menstrual cycle? And then I guess the follow-up question is, do we want that?
yeah,
Like,
yeah, exactly. That's what some people have said. Do you really want to open this gate? So, uh, we we do have we do have some ideas on how we can do that. We haven't done that yet for someone that old. Not to say that's not that old necessarily, but that old when it comes to
yeah,
contact
just
fertility, obviously.
chronologically. Yeah, yeah.
Yeah, biologically. So it's something we are exploring though, because we want to see how much can we extend the fertile years, exactly for the reason you said, because people are busier. There is, especially nowadays with for a lot of women, they have to build the careers first. And then before you know it, you're considered geriatric when it comes to fertility, and you're told by your doctor that you're old. When and then your first question would be like, well, is there anything I can do to make my body younger so I can get fertile and
Yeah.
pregnant and in a
Yeah.
safe way? And I believe you can. And I think because we understand so much more about the underlying mechanisms as to why this happens, we can target those mechanisms in a reliable way.
Yeah, I remember my second son, I was pregnant with him. I was 34, turning 35, and they're like, "Well, this is technically a geriatric pregnancy." And I was like, "Bite your tongue. I'm
Yeah, exactly. Yeah.
34." Yeah, I know.
Yeah,
But they
exactly.
classify, I mean, I understand why they do it, but just the name is so abrasive.
I
So,
also think it's a little bit outdated, in my opinion, just because you could be 25 and have a 40-year-old's body, right? And
that's right. That's
and
right. That's right.
so I don't know anymore. Like, I don't know if necessarily that blanket statement works as they used to, because of the modern accelerated aging we're seeing in a lot of people with the modern environment.
Yeah, I saw J Lo at the Super Bowl. Like, I know what 50 can look like.